There is a $300 patch you clip to your neck for 4 minutes a day. It pulses a low-voltage current into your vagus nerve, and the research suggests it does something meditation takes 6 months of practice to do. The category exploded between 2024 and 2026, but does the science actually back it, or is this the next red light hype cycle? Let's start with what the vagus nerve actually is. It's the longest cranial nerve in your body. It runs from the brainstem down through the neck into the heart, lungs, and gut. It is the master switch of the parasympathetic nervous system, the system that slows your heart rate, lowers blood pressure, turns off the fight-or-flight loop that runs chronic anxiety. When your vagal tone is high, you recover from stress quickly. When it is low, you get stuck in that keyed-up state that feels like anxiety, insomnia, tight shoulders, and a heart rate that will not come down. Meditation raises vagal tone. Cold exposure raises vagal tone. Slow nasal breathing raises vagal tone. They all work through the same mechanism. They just take time and practice. Transcutaneous vagus nerve stimulation, or tVNS, is the direct route. You clip a small electrode to the outer part of your ear or over the side of your neck. It sends a mild, painless current into a branch of the vagus nerve that sits right under the skin there. 15 minutes and your parasympathetic system shifts state. The Clancy paper from 2014 in brain stimulation is the mechanistic anchor. 48 healthy adults, 15 minutes of tVNS at the tragus of the ear, compared to sham stimulation. The real treatment significantly reduced muscle sympathetic nerve activity and raised markers of parasympathetic tone. That is an objective, measurable shift in autonomic state from one short session. Bretherton, in 2019, in Aging, took 29 adults over 55 and had them do 15 minutes a day for 2 weeks, improved heart rate variability, lower blood pressure, better mood, better sleep. Small trial, but controlled, and the direction of every marker matched the theory. Then there's the FDA-Cleared side of the market. A company called Electrode built a device called GammaCore. Silverstein published the Act 1 trial in headache in 2016. 133 cluster headache patients, randomized, double-blind, sham-controlled. GammaCore worked. That trial is the basis for FDA clearance in cluster headache in 2017. The Presto trial in neurology by Tessoroli in neurology in 2018 took 248 migraine patients and showed the same thing. FDA cleared for migraine that year. This is the important nuance. FDA clearance for cluster and migraine is real. It does not automatically extend to anxiety, but it is the same underlying mechanism, the same nerve, the same style of stimulation, and veterans have been using GammaCore off-label for PTSD. The consumer devices come in 3 tiers. Pulsetto sits at around $300. Truvaga, made by Electrode, the same company behind GammaCore, is around $500. Nurosym, which has the most peer-reviewed anxiety and HRV data behind it, runs $700 to $1,000 and is CE marked in Europe, not FDA cleared. Each one uses roughly the same principle, different intensity ranges, different electrode placements. We'll cover the protocol the research actually backs and the honest ranking of these 3 devices in the next part.
Here is the protocol the research actually backs. First, understand what you are buying. There are 2 electrode placements that have peer-reviewed data behind them. Auricular, which is a clip on the outer ear, targeting the tragus or the cymba concha. This is where most of the taVNS anxiety and HRV research lives. Cervical, which sits over the side of the neck on top of the carotid sheath, targeting the vagus nerve directly. This is what GammaCore and Truvaga use, and it is what got the FDA clearance for cluster headache and migraine. Both routes work. The neck placement tends to feel more like a strong vibration. The ear placement feels more subtle. Now, the 3 consumer devices. Pulsetto sits at around $300. Neck placement, consumer app-driven. The peer-reviewed data is thin. One open-label pilot from 2025 in ankylosing spondylitis showed reduced inflammatory markers and pain. It is the cost tier with the least published evidence, but it is the same mechanism and the same nerve. Truvaga is around $500, also neck placement, made by Electrocore, the same company behind GammaCore. Truvaga inherits the FDA-cleared parent technology behind it. Nurosym runs $700 to $1,000, sits on the ear, and has the deepest published anxiety and HRV data of the three. It is CE marked in Europe, which is a regulatory conformity mark, not the same as FDA clearance. If you want the device with the most peer-reviewed backing per dollar of published research, that is Nurosym. If you want the FDA-cleared parent technology at the lower consumer price, that is Truvaga. If you want the cheapest way to try the mechanism, that is Pulsetto. The session itself is short. Most of the anxiety and HRV research used sessions between 4 and 30 minutes. Bretherton used 15 minutes a day. The GammaCore clinical protocol for migraine uses 2-minute stimulations, 1 to 3 times per session. If you were using this for chronic stress and sleep, the practical version is 15 to 30 minutes in the late afternoon or before bed, when you actually want the parasympathetic shift to land, not first thing in the morning when you want alertness. The parasympathetic bump is the whole point. Line it up with when you need it. A few honest caveats. The anxiety RCTs are mostly small, typically 30 to 80 patients. The mechanism, the HRV shift, the parasympathetic activation, is well established. The long-term clinical outcome data is early. Frame this in your head as early evidence, not settled science. FDA clearance for GammaCore is for cluster and migraine, not anxiety. Nurosym is CE marked, not FDA cleared. And there are real contraindications. If you have a pacemaker, cochlear implant, or any implanted electrical device, do not use one of these without talking to your doctor first. Same if you are pregnant, have a heart condition, or a history of vagal nerve pathology. Skin irritation at the electrode site is the most common minor side effect across every trial. The nice thing about tVNS is what it does not do. It does not sedate you. It does not build tolerance the way benzodiazepines do. It does not have a withdrawal profile. The research suggests it works on the same nervous system pathway that meditation works on. It just gets there faster and more reliably in the short term. That does not make meditation obsolete. Meditation trains the underlying skill of self-regulation. A neck patch trains nothing. It just delivers the parasympathetic hit on demand. Some people will find that trade acceptable. Some people will not. The research points to real, measurable effect, at the size of effect that gets you to functional, not miracle territory. If you want the sleep side of this same story, the environmental fix that is quietly wrecking metabolic health in most bedrooms, check out our next video on the bedroom light problem. The link will be in the description below. This is research, not medical advice. Talk to your doctor before changing anything, especially if you take medication or have a heart condition.